Beauregard earlier this morning, the CEO with Intercommunity, and May is Mental Health Month. And Kim kindly is with us this morning. She wanted to come on, and we wanted her on. And there is such a stigma out there. I'm going to have her explain that to you. And this is what it's all about, to stop the stigma. And there's a big event happening at Manchester Community College on Monday. Kim, thank you so much for joining us.
Thank you so much, Brad, for having me.
Now, when we talk about this stigma, can you explain it to the people and the reason? And I can understand why this is happening at Manchester Community College.
Yes, they do have a wonderful addiction program there where they teach people how to work with people in the community who face addiction disorders. So Intercommunity is really a community health center, and we're health care for the whole person. So we really believe in integrated care, that you need to take care of your mind, your body, any mental health issues or addiction issues, because, again, we're whole people, and our body and mind is connected, and so one affects the other.
How long has what fascinated me was first the name, the Intercommunity, and then I just said, I wonder what they do, and now we're finding out.
Yeah, thank you. And it's true. We love the name Intercommunity because really we're an organization that's over 40 years old, a private nonprofit funded by the state of Connecticut, Department of Mental Health and Addiction Services, and by the federal government as a community health center. So we really work with people who have no or are underinsured. But we really have grown so much over the years. We're about a $25 million operation with 17 sites. We do school-based health care in seven schools in East Hartford. But to go back to the opioid epidemic, which is one of the things we're talking about, but it really is about addiction in general, is you're right. There is such a stigma to it that that's really kind of the underlying layer of it. We are seeing just so many people continue to be affected by the opioid epidemic, and people are dying of accidental drug overdoses because of synthetic drugs and things that are put in there that are not right. We have now just passed in the United States, more people are dying of drug overdoses than in car accidents, which we know is one of the number one killers. Yet 9 out of 10 people who need help never get it. And that seems
9 out of 10?
9 out of 10 people do not receive help, is some of the studies show us. And it really is because of the harmful stereotypes that are tied to addiction. So people get into this sense of shame about their addiction, shame about their substance abuse, shame about their mental health issues, and then they do not seek treatment. And again, we know that mental health and substance abuse are physiological brain disorders for most of them, and that, many people are born with these or they're pre-genetically disposed. So this isn't about blame, and it's not about someone's moral failings. It's about physical addictions that we really need to treat people for, because if nothing else, we know, again, the stats that 1 out of 6 of us is affected by someone who has an addiction or substance abuse disorder. And there are family and our friends and our neighbors. And even if you don't want to talk about that, it's the cost to us as a state and as a country when these diseases go untreated.
Kim Beauregard, my special guest, CEO with Intercommunity. One of the things that has been so troubling to me, and I get out and meet a good many of the folks that you are speaking about, is that the care. You live in a state that is pretty well off, or that's what the rest of the country feels. Connecticut is one of those leading states. But if you know about what you are doing and about the suffering, we're not well off.
Correct. There are still so many people every single day who suffer from the physical and mental symptoms, and again, the stigma and discriminations that go from people not having safe and affordable housing because it's not available to them, to just being able to eat nutritious food and many, many times not to get medication that they really may need. And so one of the things I really want to say is that our event on May 14th with Shatterproof, the old stereotypes were, and there were stereotypes, people were down and out, or people who may be homeless, or, that the addict was somebody laying on the street in the street corner. And that's just so not the case. And we need to pay attention to those issues also. But I've had more and more people come up to me whose family members, whose children have died, who are in high school or about to enter college, who just didn't know, they weren't educated, and they didn't realize, to take that pill, to smoke that joint, to whatever they were doing, really could have, life-ending effects. Again, because of what is being put in these drugs, what is synthetic drugs that are flooding the street, and because now people, have gotten, we had an epidemic of over-prescribing, so people got hooked on oxycodone or whatever, right. And then they couldn't get that anymore from their physician, and so they really went to the street drug heroin, which was cheap. It was cheap, $5 or $10 a bag, and they could get that same high. And that's what we have seen has really been killing people, because you just don't know what's in it. And it's a horrible, horrible disease that can actually affect any of us at any time. If I can just say, last year we, Fight the Stigma, we had started with a campaign called Fight the Pain. Exactly what you were saying, Brad, about people who themselves and their family members are just in so much physical and emotional pain from these kinds of illnesses. Terrible. And we brought in a chief of police who had been arrested and jailed and imprisoned because he had an athletic injury, got hooked on oxycodone, and then went to his evidence room and was stealing drugs. So you really can see that it can affect anyone and can be devastating.
Now, just describe Manchester Community College and the time and everything.
Yes, it's at Manchester Community College this coming Monday, May 14th. It's at the SBM Charitable Foundation Auditorium. It's from 6 to 8 p.m. It is with Shatterproof, with Gary Mendel, who is a national leader now on addiction, really a grassroots organization after his son died tragically from addiction. And part of it was really that he did not seek treatment because of the shame and the stigma. And Gary has now started this national advocacy program that is really working to change legislation nationwide and in healthcare practices. So we're very honored to have him and his group here, and it'll be a wonderful event. It's free to the public. We'll have a light snacks. And we really do invite anyone from the community to come, whether you have a concern or interest or want more knowledge, but just to come so you can hear the stories of how devastating it is, but also to hear the stories of the hope and how people do recover from this.
Kim, I'll tell you, this is something that the state has got to undertake. This is the reason that I wanted to do it on this program, because I know what you have done, and again, even though we don't like to talk about these things, that this is hard for all of us, but we've got to come forward. We just have to. We can't let it go the way it is.
We do.
And I'm sure you know it as well as anybody. That's
we all do, and it affects more people than you would ever think. And if you are out there and, again, go to some of these events like we're having, excuse me, you're going to meet people who, and again, you're right, it's very difficult. You're going to see people who have suffered a lot, but also you're going to see people who have a lot of hope, who have recovered, and talk about how you can do that. And so we want to hook people up with each other so that we really can fight this devastating disease.
So again, the time, I know it's at Manchester Community College, and most people know where that is.
Yes, and it's May 14th from 6 p.m. to 8 p.m.
That's this coming Monday night.
I'm sorry?
This coming Monday.
Correct, this coming Monday. And it is with Shatterproof, and the keynote speaker is the CEO of Shatterproof, Gary Mendel, who did lose his son to addiction, and he has a very inspiring story for all of us to hear.
Well, again, Kim, let's keep in touch. This is something that I have wanted to do for some time, and I just think it's got to be out there, and people have got to know, because we in Connecticut, and I did a story. This was back several weeks ago. I did a story, and Connecticut is really in tough shape when it comes to those who are suffering, and those who, because of the use of drugs in the state, and this is what's happened.
Exactly. We do run one of the biggest detox. It's a withdrawal program, so people can come into our services. We have residential services, women and children services. We do the primary care in our East Hartford and Hartford sites. So we really integrate it. We have psychiatrists who are talking to primary care doctors, who are talking to care coordinators, who are talking to nurses, who are talking to case managers, and we're really wrapping care around people. We're making sure that they have everything they need with limited resources. As we know, we've all taken very big cuts this year from the state, but this is just so important, and work that we have done for so long, as I said, for 40 to 45 years in the state of Connecticut, that we're very dedicated to it. We have a very dedicated board of directors. Our staff is wonderful, and they're caring and compassionate, and it takes a lot. It's a very intense work that we do.
Kim, I'm out of time here, but I want to we'll keep in touch. I promise you.
Okay, wonderful. Thank you so much, Brad.
You bet.